in this paper, we looked at patients with hypertrophic cardiomyopathy who underwent septal myectomy, and we also looked at patients who underwent concomitant CABG. My name is Anita Nguyen. I'm a PGY1 resident in the Joint General and Cardiothoracic residency program here at Mayo Clinic. So I'll be discussing our article entitled Septal Myectomy and Concomitant Coronary Artery Bypass Grafting for Patients with Hypertrophic Cardiomyopathy and Coronary Artery Disease. What we did in this study was we looked at more than 2,900 patients who had undergone septal myectomy for HOCM here at Mayo Clinic. And because there is a paucity of data of what to do in patients who had concomitant coronary artery disease, we wanted to focus on those patients who also underwent concomitant CABG at the same time. So we looked at more than 2,900 patients, and 246 of those actually underwent concomitant CABG at the same time as they underwent septal myectomy. When we compared those patients who had CABG versus those who had septal myectomy alone, we found that those patients were older at the time of surgery. They were more likely to be male, and unsurprisingly, they also had some of the risk factors for coronary artery disease, such as hyperlipidemia, diabetes, high blood pressure, and higher BMI as well. Surprisingly, what we found in the study was that the operative mortality, even though it was very good in both sets of patients, it was slightly higher in patients who underwent concomitant CABG. And we think that's probably related to the higher age as well as the underlying comorbidities. What further surprised us was that patients who underwent concomitant CABG had worse overall survival, especially when we looked at long-term survival. And when we then did a multivariable analysis of all patients, we found that concomitant CABG was also significantly associated with mortality, and it was an independent risk factor of late mortality. So overall, although early survival is excellent in patients who undergo concomitant CABG, there still is a big difference in late survival for those patients.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.